Hello. So today, me, Neri, and Sapinder, we're gonna talk about the digital radiograph and CT scanning in dentistry. And we're gonna have the content slide here, and we'll be including historical background of X-rays, what is a digital radiography, and types of digital radiography, a clinical application of digital radiography, perks and limitation of the digital radiography, and what is computed tomography scanning, which is CT scanning, and who invented the CT scanner, and how four generation of CT scanners are different, and a clinical difference and a clinical application of CBCT, and perks and limitation of CBCT. So right now we're gonna start with historical background of X-rays. So on November 8, 1865, William Roentgen accidentally discovered an image cast from the cathode ray generator. After a week of this discovery, Roentgen discovered its medical use after making his wife's hand on a photographic plate, which he termed an X-ray. Since its introduction in the mid 1980s, digital radiography has surpassed a traditional screen film radiography in popularity and usage. Moreover, and what is digital radiography? Digital imaging in dentistry utilize solid state sensors to computer uh, to capture image which are broken into electronic pieces and presented and stored as digital files on a computer. The beginning of digital dental radiography began in 1987 when Dr. Francis Moyen introduced the first digital radiography system known as radiovasography (RVJ). And what are so right now we're going to speak about the types of digital radiography. So one, we're going to have direct digital image are captured using solid state sensor such as a charge coupled device CCD or complementary metal oxide semiconductor CMOS based chips. The other kind or the types is going to be a semi-direct image are obtained through phosphor plate system where the numbers of electronic deposited in each pixel are transferred sequentially in each pixel and to a readout amplifier for display on a monitor. And the third type is going to be indirect digital radiographs are produced using a flat PET scanner with a transparency adapters, a slide scanner, or digital cameras. And what are the clinical application of digital radiography? So we're gonna start with enhanced caries detection. So improves contrast resolution, aiding in accurately diagnosing caries lesions. Also, periodontal assessment. So high resolution in intraoral radiography enables detailed visualization of periodontal structures. Uh, Bone loss measurement as well. Digital imaging facilitates measuring. So it's going to be like helping us to like figure out the bone loss measurement in the dentistry. Uh, Plus, we're gonna talk about. Oh, sorry. So it's going to be like the third type, or like the third application of digital radiography in dentistry is going to be like bone loss measurement. A digital imaging facilitate measuring the extent of bone loss in periodontal cases using image analysis tool for a quantitative assessment. And we're gonna have as well, it helps in endodontic detail, high resolution technology, and specialized filtering enhance visibility, allowing the detection of small endodontic details like file tip as small as zero point zero 0.06 millimeter. And also we're gonna help for detecting a cyst and tumor. So multiple section in like a digital radiography assist in evaluating cyst or benign tumors, offering a comprehensive view of axial, coronal, and sagittal planes for locating deeper tissue. And also like it helps for a post-surgical follow-ups for like additional radiography is valuable for post-surgical follow-up, especially in lesions with high recurrence rates, providing detailed imaging for monitoring changes over time.
So, what are the perks of digital radiography? Reduce radiation exposure. Digital radiography required approximately 90% less radiation compared to e-speed film, contributed to a safer imaging process for patients. Interactive image manipulation. Digital imaging allow manipulation of image parameters such as contrast, blur, and noise, providing flexibility in optimizing diagnostic quality, digital filtering for enhanced clarity. Digital filtering reduce the blur of structural boundaries, enhancing the clarity of radiograph images and aiding in the accurate detection of a carious lesion. Quantitative measurement. Digital radiographs enable measurement of length, angle, and area directly on the image, facilitating precise quantitative assessment for diagnostic and treatment planning purpose. Versatile diagnostic application. The same digital image can be used for various diagnostic purpose, catering to different needs such as lighter image for assessing marginal bone loss and darker image for caries detection. Immediate image display with CCD system, digital radiograph images are displayed immediately post exposure, offering real time visualization and efficiency in the diagnostic process. What are the limitation of digital radiography? Limited spatial information. Digital radiography, being two-dimensional, cannot accurately represent the three-dimensional relationship between teeth and surrounding anatomical structures. Unassessed buccal lingual plane. The buccal lingual plane remain inaccessible in 2D radiograph, restricting a comprehensive assessment of a spatial relationship between the oral anatomy. Incomplete maxillofacial representation due to the intricate nature of the maxillofacial structure skeleton. 2D digital radiograph may only partially replicate the detailed anatomy being assessed, potentially leading to diagnostic limitation. Superimposition and background noise. Anatomical structure surrounding teeth can superimpose on 2D radiograph, introducing anatomically or background noise that complicate the interpretation of periapical images. Underestimation of bone destruction. 2D digital radiograph may depict less severe bone destruction than is present, limiting the ability to accurately assess the extent of certain dental conditions. Lack of soft tissue to hard tissue relationship. Digital radiographs do not reveal soft tissue to hard tissue relationship, providing an incomplete picture of the overall oral and maxillofacial conditions.
What is computed tomography scanning? Computed tomography imaging employs a narrow beam of X rays and multiple rotations around an object to visualize its internal structures. It provides clinicians with detailed three dimension views of anatomical structures and abnormalities. This technology enables precise assessment of the size and extent of pathologies in various dimensions. Who invented CT scanner? The first commercial computed tomography scanner was invented in 1972 by Sir Godfrey N. Hounsfield in Great Britain. Since then, the integration of clinical CT scanning has revolutionized medical imaging and its consideration the greatest advancement in radiology comparable to discovery of the X-rays. Computed tomography was the first technology to allow visualization of both hard and soft tissues of the facial bones by image processing enhancement and the ability to acquire multiple non superimposed cross sectional images. So there are four generations of CT scanners. How four generations of CT scanners are different? The first, developed by Hansfield, utilized a single detector element and could only scan the head. The second generation, introduced in 1975, incorporated multiple detectors and a fan beam scanning method instead of pencil beam used in the first generation. So, first and second, both generations are used translate rotate design and were used to scan head only. In 1976, third generation CT scanners emerged featuring a large arc-shaped detectors that eliminated the need for translation during the scanning. These scanners are widely used today. The fourth generation scanners replaced the arc shaped detector with a full circle of detectors with the X ray tube rotating around the patient while the detector remains stationary. However, fourth generation scanners are no longer in use due to their high cost and increased scatter radiation. What are the clinical applications of CBCT? So, cone beam computed tomography is widely utilized across different dental specialties. Its high resolution enables the detection of conditions such as cysts, tumors, infections, developmental anomalies, traumatic injuries in the jaw, and bone related issues in the jaw and temporomandibular joint. CBCT has shown to be an effective clinically for identifying various bone and periodontal issues such as intrabony defects, percussion defects, adhesions, fenestrations, and periodontal cyst with high accuracy. It offers a thorough description of bone morphology with minimal margin for error. Additionally, CBCT has been utilized to assess the success of regenerative periodontal treatments. What are the perks of CBCT? Radiation dose is as little as 3% to 20% compared to a conventional CT scan, depending on the equipment used and the area scanned, does not require any additional mechanism to move the patient during acquisition, less expensive and has a higher image quality than a conventional CT scan, provides high resolution of bone and teeth, which allows accurate understanding of the relationship of the adjacent structures. What are the limitations of CBCT? The quality of images and diagnosis accuracy of CBCT can be compromised by scatter and beam hardening artifacts caused by high density structures such as enamel and radio opaque materials. Scatter radiation diminishes contrast and limits the visualization of soft tissues. CBCT cannot be used for estimating bone density. CBCT scans typically take 15 to 20 seconds and require the patient to remain completely immobile. So, in conclusion, the latest advancement in imaging technologies have transformed dental diagnosis and treatment planning by using the right imaging technology and interpreting results properly while adhering to LRA principle, which is keeping the radiation exposure as low as reasonably achievable and considering cost effectiveness. Newer radiographic methods can detect pathologies at very early stage. This early detection can lead to decreased morbidity and mortality rates and enhance patients' quality of life.